Welcome to the Health Science Podcast, sponsored by the National Health Association. I'm your host, Dr. Frank Sabatino, and today I'm especially pleased to have as my guest Anthony Masiello, who is the co-founder and CEO of Plant-Based Telehealth, which is a remarkable online virtual program that allows people access nationally to some of the most, some of the really profound experts in lifestyle medicine and plant-based nutrition. Anthony is also a wellness coach himself. He's got some credentials in lifestyle medicine, doing his own counseling and care. And I'm just so happy to welcome you to the show. Welcome. Welcome to the Health Science Podcast, brought to you by the National Health Association, the oldest organization in the world championing the extraordinary benefits of a whole plant food diet and healthy lifestyle, as well as water-only fasting. We believe that health results from healthful living and focus on evidence-based science that promotes the health of you and your loved ones, as well as the health of all animals and the environment. We feature experts from a cross-section of disciplines within the plant nutrition, vegan, psychological, environmental, and animal compassion sectors. I'm your host, Dr. Frank Sabatino, the NHA's Director of Health Education.
Thank you, Frank. Yeah, I'm super happy to be here.
How are you? It's been a while since the convention. We had a nice time spending some time talking, and I was excited to have you on this interview. So I'm real happy about that. Let me start off because, you interestingly enough, in one part of your career, you played a role in one of the greatest scientific adventures of all time, which is mapping the human genome. I'd love for you to just tell us, first of all, I want you to explain what bioinformatics is, because I don't think a lot of people would really understand that. But how did you get that gig? What was your actual role in that process when they were mapping the human genome?
Yeah, it's funny. 25 years ago, I didn't know what bioinformatics was. And now 25 years later, still no one knows what bioinformatics was. It's really interesting. So I actually got that job accidentally. And when I say accidentally, I was in school for computer science. And this was in the mid-90s, early to mid-90s. And my friends and I started tinkering around with the internet. There were no classes on internet programming or web programming, as we were called at the time, but visual web browsers started to come out where you could actually control what's on the screen. You could do visuals and graphics. And what we did was we lobbied for some classes on how to program the internet and how to actually connect databases with the internet. So we did that successfully, and we just spent countless hours in these computer labs figuring out how to do this on our own. And we got to be pretty good at it. And the community was so small at the time that we knew all the other people who were doing it. So one of my friends applied for a job at the NIH. And I didn't even know what the NIH was at the time. I was in Baltimore, Maryland. At the school I was at was the University of Baltimore. And one of my friends got a job there. And they basically, for lack of a better terms, they fell in love with him because he knew how to do all the stuff that they wanted to do. The Human Genome Project had a commitment to share the information as they were sequencing. They weren't waiting till the end of the project to share the human genome data. It's like as they generated data, they need to be sharing it. And the way to do that was on the internet, but there weren't a lot of people who knew how to program this. So he was having so much fun working down there. And I remember we were at lunch one day. He came up to have lunch with us back in Baltimore. And he said, "Hey, do any of you guys want to work with me? They're dying for people who know how to do what we do." And I said, "Yeah, I'll go talk to him and find out what we're doing." And it was kind of a turning point in my life because that was the moment that when I was there on that interview, when I was speaking to these scientists, that's when I realized that people can have professional careers. People can have jobs. People can go to work for more reasons than just to make money. These people were so mission driven in figuring out how the human body works at a molecular level. And what does the DNA do? And how many genes are there? We went to meetings at Cold Spring Harbor Laboratory and they had a guest book Like you could guess how many genes are in the human genome, and people were guessing hundreds of thousands. And it turns out there's about 30,000 genes, but there's multiple permutations of those genes. But I mean, so it was just the passion was infectious. And basically I signed up and joined right away. And I did not know I didn't know much about biology. I didn't know anything about genetics, but I just started auditing the classes at night. We were going to Catholic University, George Washington University, Johns Hopkins University. Wherever our colleagues at the NIH were teaching at night, we just went and sat in on all their courses. And we, I just kind of absorbed the information that way without enrolling in any program.
Did you have an idea of how profound it really was, what you were involved in, or were you just kind of on the fringe and just saying, I'm excited by the passion, of everything that's going on? It's funny. I spent years in science, and one of the great joys is when you actually can discover something that no one has ever really seen before. And so, this was that kind of thing. I mean, the energy and the excitement must have been so over the top and so infectious, because they were on the vanguard of a whole new adventure that no one had ever really seen before. So
yeah,
that's a remarkable place to be. The energy of that is so high and so incredible.
It really was incredible. And to answer your question, yeah, I got sucked in right away. And I started, I mean, I was at night, I mean, we worked all day, long days at the NIH. And it was such a privilege to work with these scientists and to be treated like peers. I mean, I didn't know how to do what they were doing. They didn't know how to do what I was doing. And we literally, true collaboration, figuring out how to solve these problems that neither of us could have solved independently. And then at night, it was reading the biology books, reading the genome books. Like they were the genetics books. Like they were just giving us materials to read. And I would read that, and I would read the computer science books. And as soon as a new book came out that had anything to do with internet programming, we were on top of it. We knew what was coming out, what was being published. And then as soon as it was out, we just, would consume that to stay at that kind of leading edge of the field. So I got really into what we were doing, and really proud to contribute in some way to the Human Genome Project.
Now, as we're going to segue into your kind of personal health journey, but I'm assuming that at that time was when you were still dealing with the issues of being overweight and actually relatively sick. So what was going on? Because at that point, were you at that point around the 360-pound mark that you wrote about?
I was probably around the 300-pound mark. Wow. Because this maybe a tiny bit more. This was I think I started working at NIH in 96, and I ended up leaving in 2002, shortly after the project was finished, shortly after the human genome sequencing was completed. But I grew up obese. I was overweight. I probably graduated high school at 295, close to 300 pounds. And then, as it goes, I would go through spurts where I would lose some weight and I would figure it out. And then, it would come back, and then I would get highly motivated again. And I would try to keep myself hungry or just not eat this or that and try to lose some weight and come back. But
well, let me ask you a question, because a lot of people have personal stories of health transformation. You happen to have one I found amazing that has been kind of discussed and chronicled in some of the most incredible platforms. The Today Show, PBS, Dr. Furman's book, Huffington Post. So I want to understand, if we can, and if you can relate this story, what were the aha moments for you in terms of moving into this plant-based world? And how did you have those kind of contacts, and how did that journey actually evolve to your story being told on some of the most incredible public platforms in that regard?
Yeah, it'll be interesting to try to unpack that with you. So I found whole food plant-based nutrition, and I found Dr. Furman's book specifically very simply. I did a Google search for vegetarian weight loss. And when I did, the book Eat to Live came up, and I don't even know if it was the first book that came up, but on the cover of the book, it said, key to fast and sustained weight loss. And I was like, that's what I want. And then when I read the reviews on Amazon, it was even more interesting, because no one talked about weight loss. Everyone talked about getting healthy. And they didn't primarily talk about weight loss anyway. They talked about recovering from disease, and they talked about not feeling sick anymore, and getting a lot of, gaining a lot of energy and becoming, happy and satisfied with life. And by the way, sometimes you lose some weight through that process. So, and I mentioned vegetarian weight loss because in the early 90s, even before I was working at NIH, even before I moved to Baltimore to go to school, in January 1994, I gave up meat and alcohol on the same day, January 24th, 1994. And that was one of my attempts to get healthy and to kind of create a life that didn't involve me living in my dad's basement for the rest of my life and working at his convenience store. So I didn't want to go back. Everything in the early 2000s, when I was looking for how to lose weight, everything was, Atkins, or now whatever it would be called, keto or paleo, or basically these meat-based programs that just, they never hit for me. And I was proud of the fact that I was a vegetarian. I mean, I thought, there was a compassion part that came on after being vegetarian for 5 or 10 or 15 years that made me proud of doing that. And I did not want to go back. That's why I was searching for vegetarian weight loss. And that's how I found Dr. Fuhrman's book.
And did you actually consult with Dr. Fuhrman after reading the book?
Never. It's so funny
never.
because I'm in Clinton, New Jersey, and I bought the book on Amazon. I read the entire book, and I started doing it as I read a page. I started doing what it said on that page. I mean, I was diligent.
So you did this on your own, really. This was a self study and a self-propagated dance that you set in motion without really a lot of counseling and support at that point.
No counseling, no support. There was no social media. This is back in 2005, 2006. So I didn't have any other influences, for better or for worse. And I think so many influences are distracting these days. I literally took that book. This is my manual. This is what I'm going to do. And when I had questions, I went to the back and I read the frequently asked questions. And when I wanted a little bit of motivation, I went to Dr. Fuhrman's website and I read the success stories of the people who had done his method before me and how they had been successful. And that was all I had, was that little world. And after I read the book, I read the back cover, and it turns out he's in Flemington, New Jersey, about 10 miles from me. I mean, that's close. That's less than a 15-minute car drive. And he had a family practice there, and he lived there with his wife and family. And I never reached out. I just did what I was supposed to do, according to his book.
Well, during that time, in looking at your bio, you talk about having, psoriasis, migraines, high blood pressure. So can I assume that you were on medication for some of those things at that time? So when you were doing this on your own, how were you dealing with the med part of that? I mean, what were you doing, or did you have to reach out to a primary care physician to help you with that, or how did you deal with that?
Yeah, I worked with my primary care doc, but just to back up and to let people know where I was coming from. So the reason I was searching for weight loss is because in October 2005, I was denied a 20-year term life insurance policy at age 33. And the reason I was going for the 20-year term life insurance policy is because my wife was pregnant with our second kid. And I took that being denied. I didn't get put into a high-risk category. That had happened to me earlier in life. This time it was like, no, we're not going to insure you for 20 years. And I took that as like a death sentence. Mm-hmm. So, and the reason why, it wasn't just the weight, but it was being morbidly obese. I was on medication for high blood pressure. My cholesterol was high, but I was resisting medication. It was only around 220 or something. And I was able to convince my doctor not to medicate me. I was diagnosed with sleep apnea, but I didn't want to wear the machine at night. I got migraine headaches, the kind that I would have to probably leave work maybe once a week and just kind of come home and sit in a dark room and try to fall asleep until it went away. I had eczema on my fingers that had been there for years. And I had psoriasis back behind both of my ears on my neck that would flare up and flare down, and it would kind of flake off. And this was at age 33. So I was on medication for high blood pressure, but my primary care doctor was incredibly supportive. She had no idea what I was doing. I told her I read this book. I've been doing what it said. I'm starting to lose weight. she was incredible, though. She said, I want you to log your blood pressure 4 times a day. I want you to check it in the morning, check it at lunchtime, check it when you come home from work, and then check it before you go to bed at night. And I want you to write it down every single day. And every week, I want you to bring me this log, and then we're going to figure out what to do with your medications. And really, that's the medical supervision that I needed, because it's dangerous to go too low on your blood pressure. But she didn't really mind or care. She was just supportive of what I was doing without knowing anything about it or getting involved in it at all.
Well, it's interesting because when you make these kinds of changes, blood pressure tends to drop, as we know that we've seen it so many times. And I've always been of the mind, and I tell people, is that, you don't need to make that decision, because when you're doing the lifestyle choices and it begins to drop, your physician really will have no choice but to modify that med, because if they keep you on the same med, you're going to get in trouble. So just from the sheer pressure of the wisdom of the body and the changes that the body's going through, that medication will have to be shifted. I'm here with Anthony Masiello. We're really delving kind of into his story. We're going to take a short break so we can hear from our sponsor, the National Health Association. And now, to put a smile on the sponsors of the National Health Association, you're listening to the Health Science Podcast Show. I want to remind you to visit the National Health Association website, where you'll find incredible resources to support your healthy lifestyle, including plant-exclusive eating without added salt, oil, and sugar. Simply go to healthscience.org or nationalhealthassociation.org. Be sure to check out membership, which is $35 per year for those living within the U.S. and $55 for those living outside the U.S. You'll be amazed at all the information and benefits you'll receive. As a member, you're kept up to date on the latest evidence-based tools for health promotion. You'll receive the incomparable quarterly magazine Health Science, a beautiful 40-page advertising-free publication mailed to your home or offices, loaded with articles, recipes, inspirational stories, and interviews with world leaders in the fields of personal health, plant-based nutrition, water-only fasting, animal rights, and environmental support. And you'll receive details about life-changing events, such as the 2023 NHA Conference set for June 23 to the 25th, 2023 in Cleveland, Ohio, which will be the NHA's 75th annual NHA Conference. I'm your host, Dr. Frank Sabatino, and now back to the show. Welcome back to the Health Science Podcast. I'm your host, Dr. Frank Sabatino, and I'm here with Anthony Masiello in this incredible, interesting story of his journey. Let's go the next step then. So now you make some of these changes, and then how does that story end up on these incredibly public platforms? Tell me how you meet these people, the Arianna Huffingtons and the PBS and all of this stuff. I mean, it's just really mind-bending to really think about it.
Yeah, thank you. And I never think about it in those terms. So I appreciate you bringing it in that direction. So what I did was, so the short summary of the story is I ended up losing 160 pounds in about 20 months. So less than 2 years. I also got the life insurance policy in the preferred category, but I'm kind of a cautious person. I almost wanted to say a nervous person, but I didn't know how real this was. So I just waited. I just lived life for about 1.5 years. But when I didn't gain any weight back in over 1.5 years, and I just kept feeling better and better, I said, I have to share my story. And the first place I wanted to share my story was with Dr. Furman. I had still not met or spoke with anyone at his office, but he had the success stories on the website, and he had a form. It said, submit your success story. And I submitted it through email. They put it on the website. Then every once in a while, I would get an email from his office, not from Dr. Furman, but they said, we're working on this project. Can we use your story? And they would have a release, and I would download it, print it, sign it, scan it, send it back to them all the time. And one of the releases they sent me was to include my story in the second edition of the Eat to Live book. This, I forget what year that was, but this is a few years later. And I mean, I was incredibly proud of that, Frank, because that's the book that changed my life. now the fact that I'm going to be in the next edition, so other people can be inspired now by my story, like I was just super proud of that. So I sent it in, it got included in the book. And then one day I'm picking my son up at the gym from gymnastics class. And it's like the mega gym. And it was close to Flemington. It was in between Clinton and Flemington, right here on Route 31. And I picked up my son and I'm walking, I don't know what he was, maybe 4 or 5 years old. I'm walking up the stairs at the gym, and literally on the stairs next to me is Dr. Furman. And I had still never met him in person, or never even spoken with him, or never even emailed with him, just the office. And I looked over at him. I said, "Hey, are you Dr. Furman?" And he goes, "Yeah, who are you?" And I said, "My name's Anthony. I'm one of the success stories in your book." And he looked back at me, and then his jaw dropped. Like, he's like, "Wait, what are you doing here?" What do you mean you're in my book? He's like, "Which one are you?" And I said, "I'm Anthony. I lost 160 pounds. I got off my blood pressure medications, the life insurance policy." And he goes, "Oh my God, that's fantastic." And I was kind of starstruck, Frank. I mean, this guy literally gave me a new life, right? So I said, "Okay, well, it's nice to meet you. I'll see you later." And I left. And with no intention or anything in ever following up with him again. But then his office started reaching out to me, asking me if I would come share my story. Because I guess he must have went back and said, "Hey, do you guys know this Anthony's local and to New Jersey?" So when he was doing events in Princeton, when he was doing events in Bedminster, when he was doing immersions, they would start to invite me to share my story. And I kind of felt like it was a real contribution. When I would go to a room, whether there was 300 people in the room or 20 people in the room, when I would share my story and I would see people emotionally connect with what I've done, and I got okay at telling the story in detail, I just thought I have to do more of that. So that's where some of these outlets started to pick it up. The Huffington Post was my first big one, but you know how I got to that one? I was on the internet, and there was a success story published on the Huffington Post. And below it, there was a link. It said, "Do you have a story you'd like to share?" Right? We see these things all the time, but nobody ever clicks them. I clicked it. I had my story written up, the outline of it, because it was already, included in the book. I copied and pasted into the email and said, "Hey, I'd love to share this to help to inspire people, to show them what they, to help empower them so that they can make changes for themselves." And I sent it in. I don't know how long it took. A few days later, you hear back from an editor. They start talking about it. They start, writing they start helping me to put the story into the format that they want for their publication. And then it goes out there. And then other people start reaching out, because it's out there. And friends who I never even knew would read the Huffington Post were like, "Hey, I think I saw an article about you," and stuff like that. So it was cool. And it just kind of, snowballed. Again, it was early. It was before a lot of social media. So I still don't have a big social media following, but I met a lot of really cool people who are interested in helping and supporting other people. And that's how most of these connections were made.
Look, losing 160 pounds is losing an entire person. It's a remarkable accomplishment. And I love the point that you made that, you did it over a 2-year period. We live in such a quick fix culture, which is how a lot of these kind of dangerous quick fix fad diet approaches, make their bones by some very rapid weight loss followed by very rapid weight, recovery again, reactive weight gain. So, understanding the patience and a little bit of the time factor for recovery. And if you think about it, in a lifetime, it can take you, like you said, from childhood to adulthood. You were dealing with obesity from very early in your life. And here was a situation that after a lifetime of that, devoting 2 years of your life, which was really a very small part of your whole life, to getting to the place of losing 160 pounds is just really remarkable. But I want to touch on something. No one gets to 360 pounds without really dealing with compulsive disorder and addiction. So I want to just touch on that a little bit, because I think that'll be an inspirational piece for people too. And when we talk about addiction, the field of addiction defines addiction as the continued or compulsive use of a behavior or a substance, in this case, food, without regard for negative consequence. So as you were sick and, as the person is putting on weight and they're dealing with high blood pressure and the risk of heart disease and many other things, you just keep eating. Now, I know you grew up in an Italian household, as I did, and I know, from the moment we were born, we were taught to use food to deal with a lot of the stresses and strains of our lives. But talk about the pain of that. Talk about the journey of that process of addiction, and how that played for you, and how this plant-based approach really helped you kind of overcome that.
Yeah. It's really hard. It's like people say it's hard to lose weight. It's hard to lose 160 pounds. It's hard to live at 350 plus pounds also. And, I wasn't a junk food addict. I ate a lot of food at home. We cooked a lot of food. I have been members of CSA Farms since the year 2000. So, by the time I even bought Eat to Live, I had been members of CSA Farms for 5 years, and I always vowed to eat every single vegetable that came out, to not waste anything, that came from those boxes that we picked up every week throughout the growing season. But the times that were hard for me, that were the hardest, where I was the hardest on myself, it was really at night. And it was at night when I would be having what I would define as like kind of a introspective moment, where I wasn't proud of myself. I wasn't happy with my body. I mean, clearly I was eating plenty throughout the day, but then I would sit down, and as I'm upset about the state that I've created for myself, being 360 pounds, I would be eating like a pint of Ben & Jerry's ice cream, or I would be eating some cake, or when someone was having a celebration at work or a birthday party or anywhere, I was having cake, and I was having like multiple pieces of cake. And it was very much what you described. It was using that food for comfort, but I didn't really understand what I was comforting from.
Well, let's stop right there for 1 second, because when people talk about addiction, they often talk about the fact that the disease is addiction, and the substance that we medicate with is really the symptom of that problem. So in this case, a lot of times people will look at food addiction and say, I ate that bad stuff, or I ate too much of this stuff, and they still focus on food as the problem, when food is really a symptom of a deeper problem. And that's why with addiction, there's often, not only do you have to address those triggers and the actual way that you're self-medicating, but you also have to address some of the emotional and almost spiritual components behind that. Did you have a way to access that? Was that something that you wound up doing in some way? And what were the resources, if you did, that were available to you that you found useful?
Yeah, not exactly. And I want you to help me to unpack this. So okay. The one thing that I did was I painted two pictures for myself. The picture I painted was what would happen if I didn't change. And that was dark, and that was scary, and that was death before my kids graduated high school. Right. And that scared me, because I always wanted to be a father. And that was motivating for me. The other picture I painted was, if I get this figured out, I'm gonna raise my family the way that I wanted my family to be raised. We're gonna be active. We're gonna do stuff together. We're gonna go skiing. We're gonna ride bikes. We're gonna hiking, jump rope, whatever, right? So I had that as motivation to help me get started. When I bought Eat to Live, and I did exactly what it said, in the first 3 weeks, I lost 30 pounds. And I started telling myself a different story. I started to become, instead of looking myself as someone who can't, or someone who's a failure, or someone who is overweight and has no hope, that mindset started to change, because I started saying, wow, this is working. This is great. And believe me, from 350 pounds to 320 pounds, my clothes fit better. I started to feel more comfortable, and the level of self-confidence started to increase. And I appreciated that, and I recognized that, and I kind of embraced that. and then watching the scale go down more slowly after that initial kind of shock of the weight loss. I think focusing on how proud I was of myself and how accomplished this was, and telling myself that this is going to work, that this is going to do it, it really gave me a sense of pride, confidence, and probably some accomplishment that I hadn't really had for myself personally. I had been successful at work. I was married, I had kids. I had a lot of things that I should have been proud about, but I always had this lingering layer of almost embarrassment or lack of confidence that was there, and that was coming away. And I feel like I started to change as a person while the weight first started coming off.
So you were able to do that really without professional counseling meetings. You had your family, you had your own self-motivation with the success that you were achieving and seeing, and that kind of drove you. That's great. That's a great story.
Looking back, that's exactly how I feel like it happened. And I didn't realize what was happening at the time. It's only when I look back that I can kind of see it that way. But I felt it. I mean, I got better at everything. I didn't just get better at my lifestyle. I got better at work, my relationships. I became a better parent. I was so much more calm with my second son when he was born than with my first son. It just spread out everywhere.
Now, all these years later, I think sometimes it's important for people to realize that when you are on a path to recovery, in the way you're describing, that when you've had addictions or compulsive behavior, you don't necessarily have to lose all cravings to be successful. You can still proactively not make those choices. So as you've evolved and changed now, are there times when you crave any of the old things that were triggers for you in the past, or have you really been able to move completely past that?
I've moved completely past some, and the others linger, and they're itches that I sometimes scratch. And what I mean by that is I never gave up anything. Even when I started reading Eat to Live, Eat to Live was the best book that I could have read with my state of mind at that point in time, because the Nutritarian method doesn't say you have to become vegan. Mm-hmm. It doesn't say you can never eat anything, actually. It says 90% of your calories have to come from whole plant foods, preferably a pound of raw greens a day, a pound of cooked greens a day, and whatever other fruits and vegetables you can eat, some nuts and seeds. At least that's my simple interpretation as somebody who knew nothing, and that's the only book that I read. So nothing was off the list. So I didn't give anything up until I was ready to give it up forever. I was already vegetarian, so meat wasn't any issue at all for me. And cheese, I would still have cheese occasionally, but maybe it was like once a month I would have a single slice of cheese pizza. If I would have tried to give up cheese pizza week one, I wouldn't have had a chance.
Well, because cheese has those natural opiates too, which really there's even a little withdrawal that happens with that. I know, coming from myself too, coming away from cheese, growing up in an Italian household, that was a biggie. That was bigger than sugar and other things, because it was such a fundamental part of the way we ate. We had a lot of fruits and vegetables, but there was a lot of cheese and things of that nature. And the natural casomorphines in cheese, there's actually a little bit of an opiate withdrawal when you pull away. So it's interesting that you didn't do it with complete abstinence and deprivation. You had a little bit that obviously didn't trigger you to go off on a binge or anything in that regard. You had a kind of a handle on it, which is interesting in itself. So that's amazing.
And for me, that was psychologically, that was easier to say not now rather than to say not ever, right? And practically speaking, it was almost not ever, right? Like having a single slice of cheese pizza once per month is almost like not having any, right? But I didn't have the mental weight of knowing that I could never have it again. And I just say, not today, not today, not today. And then,
but it's interesting when you get to that point where you're having a few ounces in a month. It gets to that point pretty clearly that you realize you can have no ounces in a month. And so you kind of evolve to that place without having that feeling of, absolute abstinence and deprivation, which for some people, many people, it works. And for some people, it just doesn't. And so you had a mindset about what could really work for you. I'm here with Anthony Masiello. We're having this incredible talk about his journey. Anthony, let people know how they can find you, how they can get in touch with what you're doing, websites, the most important websites or social media places where they can find you.
Yeah, well, the most important website that I have going right now is Plant-Based Telehealth. And this is me giving back fully, because I want other people to be able to do for themselves what I was able to do for myself.
And I want to get into that. That's where I want to go next, because I really want to get into that company that you were a co-founder, that you're CEO of. The mentality is to have I noticed that it's to have a broad access for people to experts, physicians, experts in plant-based nutrition and lifestyle medicine. So tell me how in your journey that path evolved for you. How did that come to be?
So we mentioned before, I was privileged to share my story in a number of outlets, whether it was media, but also in person at different conferences and different events within the space of the lifestyle medicine community and the whole food plant-based nutrition community. And I noticed a pattern pretty early on, where there would be a healer like yourself, a physician, others who are on stage, and they're talking about the science of why and how this works. A whole food plant-based diet, lifestyle medicine, how you can actually eliminate the cause of disease, you can reverse disease, you can overcome all of these health issues. And then they always share some case studies. And they show a few examples of patients, which I had been an example earlier for Dr. Furman and others. And then they go to Q&A. And then someone in the audience raises their hand and says, my name is so-and-so, and I live in wherever, in Indiana. I live in Maryland. I live in wherever. Where can I find a doctor who can help me? I suffer from that condition also, whatever it was. Where can I find a doctor who can help me? And there's not an easy answer. It's like, can you come with me to California for a few weeks? Can you come to Florida for a few weeks? Can you go to New Jersey? Can you go to, to Cleveland? Can you, what can you do? How can we connect you with a doctor? And there was no easy answer. So with my computer science hat on and working in healthcare informatics, we never really define the term bioinformatics, but it's really just, healthcare. It's just applying computer systems to problems that were related to either biology or healthcare, right? That's what bioinformatics really is. So I said, well, so maybe now there's this term medical informatics, right? So how can we use technology to eliminate this problem of people not having access to doctors who can heal them? And I knew some doctors who were licensed in multiple states, and they started doing telemedicine on these huge platforms, right? A couple of them.
Was that prior to the pandemic, or was that actually
that was prior to the pandemic?
Okay.
The idea. I mean, I got very serious about the idea for plant-based telehealth before it had a name in January of 2019.
Okay.
So more than a year, and my goal was to get it going before the end of 2019. So I started working with some doctors. I found that there were IT platforms that exist. There were a bunch of compliance and legal hurdles, obstacles that had to go over, but we got connected with an outstanding attorney that could help us to put all of those pieces in place, to write the proper contracts with the doctors, to write the proper terms of use for the website, to set up the business entities in a way that follows all of the corporate practice of medicine laws, all of these things. And then we launched. We didn't launch in 2019. We launched in March of 2020 with one doctor seeing patients in 13 states. And we launched just as COVID was becoming a thing. People were still teasing back and forth, oh, it's just the flu. Why are we making a big deal about it? All of these things. And that's when we finally launched Plant-Based Telehealth.
And in that process, originally you had a doc with 13 states. Is the limiting factor the licensure? Is that part of it? I mean, you have to have docs that are licensed in the states that they counsel. Is that how that works?
Yeah, it's two things. There's the licensure, and then they have to be insured with malpractice insurance. But the licensure is the tricky one. And the laws state that the doctor has to be licensed in the state where the patient is at the time of receiving care. So it's during the virtual appointment.
I see.
So if I live in New Jersey, but I'm in Florida and I dial in for a telemedicine consultation, I need to be with a doctor who's licensed to see patients in Florida,
I see.
not New Jersey. And at a crude state, it kind of makes sense. If I was in Florida and I cut my foot open, I would go into a hospital and I would see a doctor who was licensed to treat patients in Florida, right? If I was in New York and I broke my arm, I would go into the hospital and I would see a doctor who was licensed in New York. It's wherever you are at the time of receiving care is what's important.
I'm assuming that because these docs are well versed in plant-based nutrition, lifestyle medicine, that they tend to focus on that rather than prescriptions and pharmacology. Am I wrong in assuming that? Or
you're 100% correct. It's always about treating root cause. It's always about making lifestyle changes that will help to, if it's a healthy person, that will help to keep you disease-free over time. If it's someone who's sick with chronic disease, it's to help them to better manage that disease with less medication, or some cases to completely reverse the disease. Like, I'm no longer hypertensive anymore. I don't take any medication. I don't have any signs of high blood pressure. I'm, for all practical purposes, I'm cured. So that's what they're working towards. But it's important for them to still be licensed and to still be able to prescribe, so that just like my primary care doc did for me, when these patients need adjustments in medications, that they have it's a real doctor's appointment where the doctors can deprescribe medications. So start to eliminate medications that are unnecessary, prescribe lower doses when they still need something, but hopefully get people to the point where they're no longer requiring medication to live normally.
As this has evolved, have you seen the patient population wind up using these virtual docs as now almost their new primary care docs? So they keep coming back like you would go to doctor's visits? I mean, is it really evolved that way where they have their virtual primary care physician now?
It's almost. For anything that can be treated responsibly by telemedicine, the answer would be yes. I mean, there are people who are not happy with their local doctor, and they don't want to go to them. So they will still make an appointment with the doctor at Plant-Based Telehealth for a wellness visit or for an annual checkup or something like that. But we tell everyone, look, if you've got a persistent cough, there's not a whole lot we can do. You really need to go to somebody who's going to be able to listen to your lungs and help you to diagnose that properly. Or if you suspect that you've got an infection somewhere, you need to go somewhere where somebody can look down your throat, or somebody can, examine you in person and touch you to make sure you can be well taken care of. So we don't tell people to get rid of their primary care physician, but we are there for them to use the doctors at Plant-Based Telehealth for everything from sick care that can be treated responsibly by telemedicine, to chronic disease management and hopefully prevention and reversal. And then also for wellness visits, simply for people who want to have a different conversation about their annual blood work. I mean, I go to a regular doctor around here or anywhere else, and I go in with a cholesterol of 185. What do they say? They say, okay, you're in good shape, right? Come back and see me in a year. And Frank, it's so frustrating. I know you can understand this, because they don't have a tool for someone with a cholesterol of 185 or 190, right? They don't have a tool until it gets over 210 or 220, and then they've got the statin, and then they'll put you on the medication, and then now they can treat you. But our doctors are different, right? And you're different. We can say, hey, your cholesterol is 185. You don't require medication today, but did you know that if we can get this down closer to 150 or even below 150, we can almost eliminate the risk of you ever having a cardiac event, right? It's a totally different conversation.
Well, it's funny. You get so many people, and I'm sure you understand this, that they'll go to the doc and the blood test will never even be reviewed. I mean, it'll be basically, it's fine. And so the person may bring that to me, but in your case, they'll bring it to the docs where they can actually take the time, because oftentimes in practice, the docs don't even have the time to give a quality office visit. It's kind of in and out, and you're kind of shuffled in and out. In this process, as this thing has evolved, what, in terms of the reviews or the feedback, what are the cons that have come up? What are the things that people have said they would like to see improved in that process? Can you talk to that?
I mean, one of them is, and we struggle with this one all the time. It's that it's patient pay. Patients have to pay by themselves. We're not plugged in with the insurance system. We try to keep the appointments as affordable as possible. So they're around $150 for a 30-minute appointment. It's around $300 for a 60-minute appointment. And patients have to pay that. Now, after the visit, since this is real licensed medical care, we do provide the patient with what's called the super bill. And the patient can submit that. It's all ready. It has the doctor's information, all the diagnosis codes, all the treatment codes, and the patient can send that in. But then you're kind of at the mercy of your insurance plan, not even the company, but your plan, for what you may or may not be reimbursed, because it depends on deductible and it depends on out-of-network benefits and and all of these things. So that's something that I wish were different. That's something that we're working as we grow to try to address more readily.
So in addition to that, as the CEO of this kind of expanding, wonderful, remarkable business, where would you like to see it go? What's your vision for where this will go in the future?
Yeah, I would just like to see, I would like to see these doctors' schedules filled, because I personally believe at a deep level that the more time a patient spends with one of these doctors, the healthier and the happier they will be, and the higher quality of life that they will be able to enjoy. So at this point, and I'm proud of these doctors. I'm proud of people like yourself. I'm proud of people like Dr. Furman to even know you, to even have this conversation with you, and the 10 incredible doctors that we have at Plant-Based Telehealth. I want them to be able to make a living practicing medicine in a way that helps people like this, rather than having them go back into that system where they're doing the kind of appointment that you described, where they don't have enough time with the patients, and they don't
one of the real complaints of real docs and the experience and the negative experience they have is that they're operating in a system that is disease management, not really health care. So you're just managing symptoms and not really getting at root cause. With this approach, you're really getting into the lifestyle factors that are at the root cause of many of the problems that people are suffering with. And by applying these lifestyle factors, this plant-based nutrition, these docs can really have the joy and the reward of actually seeing people get well, and patients having the experience of actually getting well. So it's a remarkable new kind of, paradigm that really should be kind of the wave of the future.
Right. And we're just so early. I mean, our forefathers were earlier and earlier. It's came just since I've been in the world of the plant-based world, and watched lifestyle medicine kind of become an idea and then grow into what it is today. It's remarkable, but it's still so early. The systems are not set up for it. I was just at the American College of Lifestyle Medicine conference, and you know what we're missing? We don't have people walking into the doctor's office and saying, "Hey, is lifestyle medicine something that should work for me?" Right? And we see these drug commercials on TV, and the line at the end is, "Ask your doctor if blank, whatever drug is being advertised, is right for you." Right? We need patients. We need the demand. We need the public to even understand that they can treat these. They can treat their conditions by better taking care of themselves. And I think that's where our next wave has to go. And I think that's where some larger nonprofit organizations can make a huge impact, because we need like these public awareness campaigns. And I think that's going to rise the tide for everybody. And I think when patients start asking for lifestyle medicine, instead of having doctors try to very gingerly approach patients and open their minds to it, but when patients start asking for it, that's when we're going to have a major shift in the healthcare and in the health of the country.
Well, the interesting thing, and our audience, much of our audience kind of knows some of this, but a lot of people don't. I mean, we're coming from the National Health Association, where from its inception in the late 40s, talked about the hygienic requirements, which are really what is now being called lifestyle medicine. So they were so far ahead of their time. in applying the general principles and biological requirements of life to foster the outcome of health and to, reverse conditions of dis-ease and pathology. So it's interesting to watch how medicine and science has, in its evolution, kind of caught up and vindicated these early pioneers that established an organization like the National Health Association. So I'm enjoying watching that because I've had a long view of this and watching this evolution over time as to how it now infiltrates into routine medical practice. And I think it's fantastic that people now, and you're right, I mean, we need to have a commercial that shows, someone eating salads and reversing heart disease. I mean, it comes to a point where you need to see that, so to speak, because I think what happens is when we talk about conditions that promote health, I think people are aware that these lifestyle factors are preventative. But somehow when they have more serious issues, it's almost like the mindset shifts and they think they need to have some over-the-top medical intervention to kind of reverse something, when the same simple things that prevented disease, we're now finding will promote health when we've deviated from health. So I love that lifestyle medicine and the science has caught up and is vindicating a lot of that in many ways. Before we break, do you have any final words or advice or any information you'd like to share with the audience?
No, I just want to express appreciation towards everyone who's been there before us. And because when you were saying, back in the 40s and that, I can imagine, I hear people talk about how I just am standing on the shoulders of the people who were here before us. And I can imagine the 2, 3, 4 kind of crazy people back in the 1930s and 40s and 50s who were down there at the bottom. And then you just look, by the time I got into this by 2005, there were probably 50 to 100 people standing on those shoulders. And now you fast forward now to 2022, and the American College of Lifestyle is board certifying 2,000 to 3,000 physicians every year. So there's literally now there's tens of thousands, if not hundreds of thousands of people standing on top of the shoulders of those pioneers who had the guts to get out there, and in a way that would make it last. They could have took this information with them.
That's right.
But they left it for us. And I mean, I just get chills because how could we ever be thankful enough? Right.
No, it's beautiful. It's beautiful. We're so fortunate to have been able to stand on the shoulders of those pioneers. Absolutely. Yeah. Well, I want to really thank you. This has been a great discussion. I've loved interacting and spending this little time with you. I want to thank you for your time, your words of wisdom. And I encourage people out there to follow Anthony, to look up the Plant-Based Telehealth program. The website will be in the show notes. And I especially want to thank our listeners, our viewers out there, because without you, I couldn't do any of this. We couldn't do this. And I want, on behalf of the National Health Association, I really want to thank you for being part of this active community. And I'm Dr. Frank Sabatino, the Director of Health Education for the National Health Association. And I so look forward to being with you on the next episode of the Health Science Podcast. You've been listening to the Health Science Podcast, brought to you by the National Health Association. Thank you for joining us today and for your commitment to evidence-based health science that backs a whole food, plant-exclusive lifestyle and contributes to the well-being of all people, animals, and our environment. I'm your host, Dr. Frank Sabatino. Be sure to leave a rating and a review, and we'll see you on the next show.